Hi there, my name is Janine McIntyre. My student ID number is 344267, and today is a lab demonstration for intravenous piggyback medication administration. Here's my identification. I'm going to begin today's video by showing you all my paperwork. Okay, med label. This is the scenario. Drug parental monograph, and I've labeled that right here. This is page 2 of the monograph. This is the compatibility chart. This is part of the order. Another part of the order. Final page of the order. And finally, the MAR. Okay. I'm just going to show you my room. I've got a power supply hooked up, pardon me, just in case. Okay. All right. Here's the lab. It's my desk. Down below, up above. Okay. And the rest of the room. Oh, I forgot to put my broom away. Okay. Okay. Step back a little. Okay. That's the view. Okay. I'm going to begin today by hand hygiene. Okay, so today's procedure is for Allison Chinook. She's a patient who's been admitted with right invasive ductal carcinoma, requiring chemotherapy and symptom management. The time is 0700 hours, and Allison is due to receive her scheduled medication to prevent gastric ulcers. Okay, so I'm going to sign this to indicate that I understand. Janine McIntyre, June 25th, 0700 hours. Okay. So the first thing I'm going to do here is to read through my doctor's order. Okay. So the order reads as follows. This is for Chinook Allison. She's our patient. Her hospital ID is 614973042. Her date of birth is December 11th, 1960. She's female. She was admitted today for chemotherapy and symptom management for a diagnosis of right breast invasive ductal carcinoma. She has no known allergies, and she has R1 goals of care designation. She's got orders here for several medications, ampicillin, dexamethasone, furosemide, ketorolac, metoclopramide, pantoprazole, and ranitidine. Okay, there's also morphine, PRN for naloxone. She's on IV therapy for flush saline lock, as well as a continuous flow at 30 mL per hour of sodium chloride, 0.9%. There's some labs as well as some diagnostic, she's got a diagnostic imaging, sorry. So today, based on the scenario, we're really gonna focus on the 0700 medication for the prevention of gastric ulcer. Okay. So now that I've gone over my order, I am going to have a look at the MAR. So the MAR here states that at 0700 hours, she's due to receive 2 medications, ampicillin as well as ranitidine. So because I'm new to the medications, I'm just going to verify that I know what ranitidine is. So that's where I'm going to reference my parental monograph. And according to that, the indications are for prophylaxis of gastrointestinal hemorrhage from stress ulceration. So I know that prophylaxis is for prevention. So this is the one we're going to use for prevention of gastric ulcer corresponding to her scenario. So I know that based on this and what that medication does, the monograph that is, that I'm going to be administering ranitidine. Okay. So again, on the doctor's order, I'm just going to have a quick look at ranitidine. So the ranitidine is 50 milligrams Ivpb, which means intravenous piggyback, and OD is daily, and it's to start today. Then I'm going to go back to my MAR for ranitidine. It checks out, same medication at 50 milligrams Ivpb. So the route, the medication, and the dose are all consistent, as well as our patient Allison Chinook, ID 614973042. Okay, so we're going to be administering ranitidine via Ivpb. So now I'm going to set my orders aside. I'm going to head into the med room, wash my hands again. Okay, so I'm in the med room. I've compared my order to the MAR. So now we're going to be working off of the MAR. Okay. So ranitidine. Okay, so before I pull any medication, I'm going to have a look at how I'm going to be administering this. So again, the order calls for intravenous piggyback as well as the MAR. So I'm going to make sure that it is compatible on the monograph for that type of administration. So acceptable routes are direct IV and intermittent infusion. I see there intermittent infusion is Ivpb. So yes, we have the right route. Again, the indication is for prevention of gastric ulcer, as well as we have a dose here. So the dose for an adult for prophylaxis of stress ulceration is 50 milligrams. There's some indications here for other reasons why you might get this medication, but I'm just going to stick to the prophylaxis here. The administration can be either direct IV, intermittent infusion, continuous infusion, or intramuscular injection. So we're going to focus today on intermittent infusion, which is what the Ivpb is. And for that indication, we're going to dilute the medication in 25 to 100 mils of IV fluid and infuse over 15 to 20 minutes. So I'm going to use my scenario for my med math, and I know right now that it's going to be over 20 minutes. Okay. So we're going to be looking for fluid to infuse, as well to dilute the medication in that fluid. We are looking for compatible in normal saline. So dilution for IV infusion is normal saline. This medication is available in a 25 milligram per milliliter dose in either 2 ml or a 50 ml vial. The stability for the vial is they should be stored at room temperature and protected from the light, and the infusions prepared on nursing unit should be used within 24 hours of application. There's a few potential hazards we're going to take note of here. Headache, malaise, dizziness, somnolence, insomnia, vertigo, blurred vision, constipation, diarrhea, nausea, vomiting, and abdominal discomfort or pain, rash, urticaria at injection site, elevated AST and ALT, also tachycardia or bradycardia, and PVC. The contraindications here are hypersensitivity to ranitidine. The nursing implications here are precautions during use with caution in patients with significant liver impairment, dose adjustments required in severe renal failure, in patients with factors predisposing to cardiac rhythm disturbances, bradycardia associated with rapid administration may occur. Monitor AST and ALT is recommended if patient is treated for 5 days or longer or has pre-existing liver disease. Changes in levels of abdominal discomfort should be monitored as well. So that'll be one of my patient teachings. Okay, so we've thoroughly read the parental monograph and we know what we need to do from here. Okay, I'm just going to set my MAR in my scenario above. My monograph is here. First thing I'm going to do is put some gloves on. And I'm going to pull my medication and my intravenous dilution, my fluid for intravenous infusion. Okay, so first thing is the medication. I'm going to check this to the MAR. Okay, so we don't have patient identification on this vial, but we do know that we're looking for the route, which is IV. It states here on the vial, either IM or IV, so we have the right route. We know that we need 50 milligrams, and in the injection vial, we have 25 milligrams per milliliter, which means we need 50, so we're gonna multiply this by 2, which gives us 2 milliliters. So again, I'm gonna write 2 milliliters as part of my medication math for my total volume. Okay, so we've got ranitidine, 50 milligrams. We know we're gonna use 2 mils. The expiry is October 2023, so well within range. And this vial contains 2 mils. Okay, so we've got right medication, expiry, the right dose, the right route. All right, the vial compares to the MAR. Next thing I'm gonna do is pull out my, my infusion bag, which I'm gonna dilute my medication into. So it says on the monograph, we need a bag that contains between 25 mils and 100 mils. The bag I selected today has 50 mils, so we've got the right volume. Again, I'm gonna put that as part of my total volume of fluid. So we've got 52 mils of total volume. Okay, we're looking for 0.9% sodium chloride for injection, so that is the right route again. We've got Ivpb on our order and MAR, and 50 mils. So we've got the right volume, the right drug, and the right route, as well as the expiry on this bag is June 21, so it's good we're using it now. It's just about expired. Okay, so again, what I'm gonna do here is I'm actually just gonna take a double check on my compatibility chart to make sure ranitidine is compatible with that solution, the 0.9% sodium chloride. And I'm seeing here ranitidine, 0.9% sodium chloride is compatible, so we're safe there. As well as it does indicate the same thing on the monograph, that is recommended for the infusion to dilute with saline. Okay. So now what I'm going to do, I checked my monograph and I've pulled my mini bag based on the monograph. So I'm going to grab, I'd like you to visualize that. Okay. I'd like you to visualize that this came out of its sterile packaging. I just ran out of supplies through my practicing. So what I'm gonna do is I'm gonna pull back, I've got an 18 gauge blunt fill needle and I've got a 3 milliliter syringe. The 3 mils is because I only require 2 mils for the medication. So I've got the appropriate size syringe. And like I said, the blunt fill needle. So I'm gonna pull back 2 mils of air. Okay. We need to scrub the hub on our vial. Okay, so before I can inject that air, I need to clean my hub. So that's what I'm doing now for 30 seconds. Vigorously rubbing. Okay. I'm going to put that down. Okay. Okay, that's 30 seconds and I'm just gonna let that dry. Okay, it looks dry now. So I'm gonna remove the cap to my syringe. I'm gonna inject the 2 mils of air. And now I'm gonna take out 2 mils of my ranitidine. A little air bubble in there. Okay, just a little bit past. I'm just gonna put that in the garbage. Okay, using the scoop technique, I'm gonna recap my syringe. And now I'm gonna do my second check on my syringe itself. So I withdrew 2 mils of ranitidine. Ranitidine corresponds to the MAR. 2 mils at 25 milligrams per milliliter equals 50 milligrams. So I have 50 milligrams of ranitidine in my syringe, which corresponds to the MAR. It's for IV, and for today, June 25th at 0700 hours, and for Chinook, Allison Chinook. Okay, so that's my second check there. So before I fill this bag, I'm just gonna take a double check according to the monograph. So 25 to 100 bag, I have a 50 ml, so it's in the parameter, 0.9% saline. That's on the dilution for IV infusion as compatible. So we're gonna go ahead and we're going to inject our medication, ranitidine, into our mini bag. So what I'm gonna do is I'm gonna scrub the port on the mini bag. Okay. I don't know if you can see. I'll hold it nice and close. There we go. I'm going to inject 2 mils of ranitidine into my saline. Right away, I'm going to put my needle back in the sharps along with the blunt fill cap. Okay, so my bag is here. I'm going to label that straight away. This is ranitidine. That's the medication at 50 milligrams. In 0.9% sodium chloride. NaCl. Patient's name is Chinook Allison. I'm also going to put her ID number here for 61497-3042. This is added by me. And this is due tomorrow, 2021, June 26th at 0700 hours. And I forgot to indicate the route on here, so let's do that now. Okay. So my medication label states ranitidine 50 milligrams for 2 mils of medication, infused in sodium chloride for IV push piggyback for Allison Chinook, prepared by myself, and the date. So I'm placing this on the back of our mini bag. Okay. So now I'm going to do my third check here. I've got ranitidine in my bag, ranitidine in the vial, and ranitidine on my MAR. 50 milligrams, and I know I injected 2 milliliters, which is 50 milligrams. It's for IV on the vial, and IV on the MAR for today's date, June 25th at 0700 hours. So we've got the right route, the right medication, the right dose, the right patient, and the time and date. Okay, so I'm ready to put that vial back in my clean hold. My sharps container's there. At this point, I'm going to take off my gloves. I'm gonna wash my hands. Okay. So what I'm gonna do is I'm gonna finish my math now. So I know I have 52 milliliters of total volume. I'm gonna multiply that by 60 minutes per hour. Trusty calculator. 52 times 60 is 3,120. And then we're going to divide that by the total minutes we're going to infuse over, which is 20 minutes. Okay, so what we have here is we have our infusion rate of 156 milliliters per hour. Minutes. Okay, so got my total volume times 60 minutes per hour. The minutes cancel, which leaves me with 156 milliliters per hour. That will be our rate of infusion. Okay. Okay, so I'm going to take my secondary line, my med bag, and my MAR to my patient. And I'm going to wash my hands when I get there. Good morning, Allison. My name is Janine McIntyre. I'm a practical nurse student with Bow Valley College. How are you this morning? Allison says she's doing really good. Allison, I'm here this morning to administer a medication called ranitidine. It's for the prevention of gastric ulcers. Do I have consent to administer this medication for you? Allison states it's okay. So now that I've got my hands nice and clean, I'm gonna check her ID. All right. Allison, could you please state your first and last name for me and your date of birth? So here I'm going to check that against our mini bag and the MAR. She states her name is Allison Chinook. Her birthday is December 11th, 1960. So I don't have her birthday here, but I do have her health number, and I'm checking that to the bracelet. 614973042. So that to the MAR, to the bracelet, her name, to the bracelet, to the MAR, and to the mini bag. So her ID checks out. Allison, do you have any allergies? She states she does not. So what I'm going to do now is I'm just going to assess her IV site. So Allison, do you have any pain here? No? Okay, so no complaints of pain. It's not tender. There's no swelling. I don't see any vein tracking indicating an infection in there, so that's good. Has this been leaking at all that you can feel? No, and it doesn't look like it's leaking. The line doesn't have any air in it. Okay, and the current solution is labeled here on the primary line of sodium chloride 0.9% at 30 mils per hour, and this was began this morning. As well as I'm noticing that the dressing is intact. I can see right through it and everything looks good. The skin looks really good. Again, no ecchymosis, swelling. The site looks very healthy, ideal site. And this site was started this morning as well at 0400 hours when she was admitted. So first thing we're going to do here is I'm going to bring in my secondary medication set. And I've also got a alcohol swab pad. Okay, so first thing I'm gonna do is I'm gonna try to avoid touching anything here. I'm gonna put the clamp closed and I'm gonna hook up this. So my primary line will now go down, and by gravity, the pump will grab the highest bag first. So I'm gonna hang my medication. Okay. Grabbing an alcohol swab again. Careful not to touch anything here. I'm going to grab this port and I'm going to give it a good clean. Okay. The port is clean. So I'm going to hook my secondary line into that port that I've just cleaned. It's nice and secure. The clamp at this point is closed. So what I'm going to do is I'm actually going to back prime the line by holding it lower than the bag and opening this. So I'm going to keep this over here, and what I'm looking for is my drip chamber to fill between 1/4 and 3/4, and that's where it's at now. It's at just over 1/4 full. So now that it's primed, I'm going to avoid touching anything after. I'm going to remove the cover on the spike, and now I'm going to spike my bag. So I'm going to pop off that blue cap, careful not to touch anything, and I'm going to work that in there. So now I've got my medication spiked. It's higher than my primary line. Before I do anything, I'm going to label this. So today's date, June 25th at 0700 hours. This is on the secondary line, and this is ranitidine. Ranitidine, 50 milligrams. Okay, and now this is time for, I'm going to write my rate of infusion here as well. This is going to run at 156 milliliters per hour. Okay, so I'm just going to label this before I forget. Okay, so it's right there, very visible. So now that I have that, I'm going to set my pump. So I'm going to click that in there, and I'm going to program the rate of infusion at, I'm just going to double check, at 156 milliliters per hour. Okay. So open that up, and I'm noticing that I've got at least 2 drips in my drip chamber. So the medication is running smooth. Again, no air, the line looks good. Okay, so I'm just gonna clean my mess here. Sign my MAR, JM, and the date is June 25th at 0700 hours. Perfect. Okay, Allison, how you doing? You're doing okay. So Allison, I just want you to let me know by ringing your call bell if you experience any abdominal pain. That could be something that we're going to be monitoring for. The medication can cause that. So please let me know if you experience that. As well, if you notice there's any drainage from your IV site here, any pain, itching, burning, or swelling, those are all things that if you could alert us to right away, that would be great. So if you're safe and you're feeling okay, brakes are on, bed is nice and low, and Allison states she's comfortable. So with that, I'm going to wash my hands again. This is about the time when I would go and do my charting. Oh, I forgot to mention, and this is something that obviously I did in my head, but I forgot to verbalize. I'm just remembering now that this saline bag that's currently running, what I would do is check it for compatibility to make sure that it coincides with the medication that we're giving. So 0.9% sodium chloride, again on the compatibility chart, is compatible with ranitidine. So because those will meet in the same line, we need to make sure that it's not going to have any adverse effects, and of course it won't because they are compatible. So happy with that. Like I said, we're going to move on to our charting and come back and monitor her in a few minutes just to make sure everything's okay. And she's got her call bell so she can notify us if she needs anything. Thank you so much. Have a great day.